Hello, I'm Tama Duffy Day. I'm a fellow with ASID and I am a lead accredited professional. I am nationally recognized for planning, informing, healing environments, and I am a principal and national healthcare interior sector leader for Perkins & Will. And Perkins & Will is a national and international architectural firm. We were established in 1935 and really established a reputation for great service and design innovation in healthcare and educational facilities. And we are celebrating our 75th anniversary this year. Mentorship is really an incredible component of the interior design profession, and I have really been blessed with having incredible mentors throughout my career. The very first mentor that I remember is Linda Blakesley, and she and I worked together in a small firm in Minneapolis, Minnesota. And in addition to being an incredible designer and patient and kind and thoughtful in how she allowed me to ask a lot of questions, one of the things she really taught me was not only what I was doing, but why I was doing what I was doing. And understanding the why element of design was really informative in me shaping and understanding all of my future design projects. In the last few months in interviewing and meeting with potential new employees, what I recognized was something missing. And I thought back on the hires that we had made in the last year, and I tried to remember what about that conversation with them and what about the conversation and looking in their portfolio really made a difference. And I recognized that what they brought to the interview was a conversation about what they learned in their schooling. But in addition to completing the requirements for school, they went well beyond that. They re-investigated the questions that their instructors asked them. They redrew some of their project solutions. And in addition, they were investigative and went beyond the typical questions. And so really the important part for me is that I look for someone that is inquisitive. When I first started in interior design, I worked in an office focusing on corporate interiors. And unbeknownst to me, I was staffed on a healthcare project for the Mayo Clinic. And initially I thought I was being demoted because in the early 80s, healthcare was not a very innovative place to be in. But because jobs were really at a rare moment at that time, I accepted the position and I worked on this amazing project at the Mayo Clinic. I learned a ton. I worked with incredible people, and I really understood the importance of healthcare and how much an interior environment can affect healing. So that project was very inspirational basically in my career. It won a design award and was recognized for innovative planning and design. And through that, I really understood there was a gap in the profession and that there was an opportunity for me to help shape and form healthcare spaces in a really big way. So for those of you that might be given an opportunity that doesn't really seem like something you want to do, I really encourage you to give it a shot and try it, because that opportunity for me that I initially thought was a real bummer and was something I didn't want to do created a path for me and shaped my entire career and really allowed me to be incredibly successful. Actually, I've been thinking a lot about that. I've been asked the question by a couple people, and I think that I would have loved to have trained seeing eye dogs. That there's something about teaching something to an animal that I think would be incredibly powerful, and that I would learn a lot about myself in trying to train an animal. When I started in this profession, really all of schoolwork tended to be a solution you created yourself. And what I really wish someone would have told me is that I would be working on teams with 25 to 35 people. And I'm not sure if I would have learned something differently, but I would have been more aware and perhaps paid more attention to the importance of communication and communication skills. In my mind, I really think a design leader needs to have wisdom and vision. They need to understand what they want to accomplish with their role in design and in shaping environments where we spend 90% of our time. As As a new designer, the one element that I was constantly inspired by was really seeing how other people had solved problems. And initially, in my early life, I grew up in North Dakota, and so a lot of time I spent out of doors. And then my career moved me to New York City, which I spent much more time indoors, and I was constantly amazed at the innovation that New York City has and that all of the environments in New York City offer. But now, it's spring in Washington, D.C., and every single piece of flower is coming out of the earth. And I really recognize that I'm going back to my roots, and the part that really inspires me the most is nature. And watching nature evolve and change in the seasons is incredible. One kind of memorable moment really inspired me in terms of recognizing the importance of design, and something that needs to be paid attention to very closely is that I went to visit a family member who was in the hospital, and I could not find my way around. Every place looked the same, the signs went on forever with language and text, and it was too much to read, and I was very stressed in finding this family member. And after I kind of removed myself from that situation and I thought about the experience, I really understood the importance of understanding place and wayfinding and creating destinations along the journey in a healthcare environment that's memorable, that allows someone to understand very clearly where they are in the facility and understand that they're not lost. The best advice I was given in my career is you're going to spend a lot of time at work, so love what you do and create a difference.